Good afternoon, and thank you for joining us today. This media briefing is taking place at the Wisconsin Department of Military Affairs, where staff from multiple state agencies have been working out of the State Emergency Operations Center on the ongoing response to COVID-19. Today's briefing is being carried live on YouTube. Joining us today are Major General Paul Knapp, Wisconsin's Adjutant General, and Department of Health Services Deputy Secretary Julie Willems Van Dijk. They will be providing an update on the important work that continues to take place here at the SEOC. After some brief opening remarks, we will open the line to questions from reporters in the order in which they RSVP'd for this event. We will go first to Major General Paul Knapp, Wisconsin's Adjutant General.
Good afternoon, ladies and gentlemen. I'm Major General Paul Knapp, and I'm Wisconsin's Adjutant General. In that role, I command the 10,000 citizens, soldiers, and airmen of the Wisconsin National Guard, and I'm responsible for overseeing Wisconsin Emergency Management and our State Emergency Operations Center, otherwise known as the SEOC or SEOC. Once again, I'd like to thank you for taking the time to join us this afternoon as we give an update on our efforts in response to COVID-19. The Wisconsin National Guard is busy with more than 1,000 citizen soldiers and airmen serving in direct support of the state's response to the pandemic. Several mission highlights include the mobilization of specimen collection teams in an effort to increase the state's COVID-19 testing capacity. We have established testing at a number of senior living facilities, correctional institutions, and other organizations. We are also conducting call center operations to assist with notifying people of their results. Other ongoing missions include a warehousing mission where soldiers are receiving shipments of personal protective equipment, also known as PPE, repackaging them and distributing them across the state. We are also involved in shipping testing supplies all across Wisconsin. We have additional citizen soldiers serving as temporary nursing assistants, and we are supporting state-run voluntary self-isolation centers in Madison and Milwaukee with medical monitoring and administration. We have another team supporting the Dane County coroner assisting with mortuary affairs operations. We continue to work hand in hand with our partners across the state and at the local level in support of Governor Evers' COVID-19 response. I'm extremely pleased with the soldiers and airmen who have played such a vital role in this response. I am equally proud of our State Emergency Operations Center, where members of Wisconsin Emergency Management are working hard behind the scenes. The work being done out of the SEOC has been critical to ensuring PPE and specimen collection supplies are making it to those working on the front lines of the response to COVID-19. I'm very happy to report that yesterday we welcomed home approximately 150 soldiers returning home from Afghanistan. These men and women are part of the 1st Battalion, 128th Infantry Regiment. I want to stress that the return of these brave soldiers is not COVID-related, but part of a planned drawdown in Afghanistan that was announced earlier this year. I look forward to answering your questions, and again, thank you for the opportunity to provide an update on the state's response to the COVID-19 pandemic.
Thank you, General. We will now hear remarks from DHS Deputy Secretary Julie Willems Van Dijk.
Good afternoon. I am very pleased to be with you this afternoon as well, and would like to talk with you about where we stand with testing and tracing. Testing, tracing, and tracking the spread of COVID-19 are key components of our Badger Bounce Back Plan, and none of them can happen without an adequate supply of the PPE that the General was just speaking about, or adequate hospital capacity to both treat COVID-19 positive patients and provide care for all the other conditions that make us sick. Badger Bounce Back is an interconnected plan. No one part of it is enough on its own, and all parts need to happen at once. So, as I mentioned, today I'd like to dig into testing and tracing with you. Testing is integral to Badger Bounce Back. We've all heard this from the national media from the very beginning of this crisis. We need more tests, and they're right, and here's why. Even though we have done an outstanding job of flattening the curve by staying safer at home, we are all still susceptible to COVID-19. So to make it safer to leave our homes, we need to substantially increase testing so we know who has COVID-19 and we can make sure that ill people and their contacts who may be incubating the disease continue to stay at home until they're through that incubation period. It's about isolating or boxing in the people with the virus rather than isolating and boxing in all of the people. So taking our lab capacity from the ability to perform 0 COVID-19 tests in early March to nearly 11,000 tests per day now is one of our success stories here in Wisconsin. But capacity is not the same thing as utilization, and we have some work to do here. Currently, we are using between 2,000 and 3,000 of those 11,000 tests per day. The most important thing for the residents of Wisconsin to know is that we are increasing to testing and that anyone with symptoms should contact their healthcare provider and ask to be tested. This is a big change in the guidelines for our healthcare providers when it comes to test access. Only a month ago, we told them that they should only test the most ill people due to the shortage of testing supplies. We've recently updated our guidelines to encourage this widespread testing, and we acknowledge that it's a big shift, which is why we have a team here at the SEOC working with healthcare providers. Clinics that would typically counsel people to take care of symptoms at home so they don't bring infections into the clinic are now being asked to change from an individual health focus to a public health focus, and that means bringing in more people to test. But testing alone is not enough to contain the virus. Another key part of Badger Bounce Back is tracing every one of those positive tests. This means that we contact everyone who has a positive test. And in fact, we are moving to contacting everyone who has a test, even before they know the results, to let them know they must isolate at home until their test results come back. And then if they are positive, they need to stay at home until they are symptom-free for at least 3 days. We also need to identify the person's close contacts who are at greatest risk for developing COVID-19 and spreading it to others, so that we can tell them to quarantine at home for 14 days, that period of time when they may become sick. Contact tracing begins with your local health department, and because of the increasing workload, the State Department of Health Services has also been supporting many local public health departments in this endeavor. To help with their workload, DHS has trained 259 contact tracers from our own department and other state agencies. These contact tracers are currently working in the field, and we are onboarding 78 more, plus an additional 50 who will start training this week. Our goal is to have 1,000 contact tracers between the DHS surge capacity and the capacity of local public health departments. We are also investigating ways that technology can assist us with this very big task. Just think about what we're aiming to do. If we conduct 85,000 tests per week and 10% of them are positive, as we're seeing now, we will need to interview 8,500 people. And if each of them has 5 contacts, that's another 42,500 people to call. We're not there yet, but we're making progress. Just like Badger Bounce Back is an interconnected plan, the SEOC is doing work that is interconnected with the work you are doing by staying safer at home. By limiting trips to only going out for the essentials and physical distancing, you are all working to flatten the curve, just as we are taking actions like expanding testing and contact tracing to make our community safer once we begin to open up more businesses and services. Thank you for your partnership and for all of your hard work. And I, too, welcome your questions.
At this time, we will open the line to questions from reporters. Reporters will be called on in the order in which their RSVP was received. In the interest of time, we'll be taking one question per outlet. All lines are currently in listen-only mode. Once called on, reporters should dial *6 to unmute their lines. Once you've asked your question, we please ask that you remute your line using *6 again. We will begin with Ryan Curry from NBC 26. Ryan? Star 6 to unmute, Ryan. All right, next we will go to Danny Maxwell with WKOW TV. As a reminder, Star 6 to unmute your line.
Hello, hi, thanks for taking our calls. I wanted to talk with Ms. Van Dijk again, or just ask another question about contact tracing, which you talked a lot about here, but just wanted to, if you can expand on just DHS's efforts to expand contact tracing, getting more people doing this, and how this really works to fortify additional testing and getting a handle on the status of coronavirus in Wisconsin.
You bet, Danny. So right now, there's two things I want to say. First of all, contact tracing is nothing new to public health people. We have been doing this for centuries to control disease, and every day for many different diseases, your local public health department follows up with people to assure that they have proper protection or prevention of spread of disease. So this is a very common skill that public health practitioners have. However, I like to say this is like contact tracing on steroids. Because of the number of people we're talking about, because of the number of susceptible people we're talking about, we need to both increase the number of people who are doing this, and we anticipate as we test with much larger numbers, it will exceed the capacity of local health departments, and that's where the state stands ready to assist them in these efforts. The other thing we've recognized is there are ways to allow technology to help us with this. And so we are working quickly, looking at vendors that can help with ways that we might be able to do some of this contact tracing through texting or through online applications. And third, the thing that is really important as we move forward with this is that it is done in a timely manner. Right now, oftentimes someone has a test. It takes several days for the report to come back. It may take another day to come into our data system, and then a contact tracer is calling them. So it may be, 3, 4, 5 days from the time their test is done. With this new approach, what we want to do is start the contact tracing when the test is taken, so that everyone who has a test knows, I need to isolate until I get this test result. We know we're getting all the good contact information to be in touch with that person once we have the test results, and so it's moving it much earlier in the process. I hope that's helpful to you.
Thank you. We'll go next to Sean Kirby with Wisconsin Health News. As a reminder, star 6 to unmute your line.
Hi, thanks for taking in terms of the National Guard specimen collecting teams, how many of those have been sent to nursing homes, and can you identify what nursing homes they've been sent to? And is DHS looking at widespread testing of nursing home residents and staff?
First off, to address the National Guard portion, we have sent National Guard specimen collection teams to a number of long-term care facilities and nursing homes. You have seen a few of them in the news already. I don't have a list in front of me of the exact locations where they've been so far, but they've been very successful in both getting the tests and then helping those facilities to further do isolation and other protective means to keep their residents safe.
And in terms of DHS and our recommendations about further testing, we are continuing to refine those, but what I can assure you is that certainly we will prioritize our most vulnerable citizens in testing, which does include older adults. And so we've worked very closely with the National Guard and with our public health and emergency management partners as we've seen outbreaks in nursing homes to be able to do this aggressive testing to protect the health and safety of the residents of those facilities.
Thank you. We'll go next to Rachel Glosh with WTMJ TV. As a reminder, star 6 to unmute your line.
Hello there. This is for the Deputy Secretary. We know the response to the lawsuit filed last week by the state legislature is due to the Supreme Court today. Will the Department of Health Services be responding? And if so, can we get a copy of that response?
The Department of Justice is handling the response to that, and so I would direct you to them for that, a copy of any of the materials.
Thank you. We'll go next to Taj Mahal with WMTV NBC 15 in Madison. As a reminder, star 6 to unmute your line.
My question has been answered. Thank you.
Thank you. We'll go next to Mason Dowling with WAOW. Mason, star 6 to unmute.
Hi, can you hear me?
Yes, we can.
Perfect. This question is for Deputy Secretary Van Dijk. I just wanted to ask your opinion. Given the fact that we're seeing kind of daily small spikes, especially after late last week, early this week with Brown County, in the number of cases being reported, and we're starting to open up through Governor Evers more things that people can do, what do you think the state of the curve kind of is right now in Wisconsin?
Well, what we know is that this is a ferocious little virus, and it is very infectious. And so we anticipate that we will continue to see spread of this virus, especially when people are in situations where they may be working closely together. And so the kinds of things that have been opened up in terms of the governor's new safer at home orders were things that are very low risk, that do not have much person-to-person contact, but could help a little bit in the economy and a little bit in terms of people's sanity and being able to get outside and do things with the increased rentals of outdoor equipment. And so this is going to be a balancing act on a tightrope walking forward. We want to do things as we can to make it safer to open the economy. We all are going to need to change our behavior and continue to change our behavior even as we go out. I think we will start to see things like face masks out in public as the norm rather than the exception. We need to remember what 6 feet apart is. We need to make changes in work sites. We have many work sites still ongoing right now. And as much as possible, we need to be working with employers to think about what are the things we need to do good infection control, good physical distancing, putting barriers in place between people to reduce transmission of the spread of the virus. And all of that will be necessary as we continue to open up more to reduce disease transmission and minimize the number of spikes we see in positive cases.
Thank you. We'll go next to Scott Bauer with the Associated Press. As a reminder, star 6 to unmute your line.
Hi, thanks for doing the call again today. Can you both give an update on positive cases tied to the election, including among National Guard members?
Great, I'll start off with that one. Being that we're over 2 weeks out from the election, I don't anticipate any updated numbers past beyond what we talked about the last time that we met and what's already out there in the news. We've already, I think it's 18 days since the election, so any new cases involving Guard members that may have served at the polls really would have no way of directing those back at the election. And as I mentioned and the Deputy Secretary mentioned the last time, it's really difficult to tie positive cases of COVID to include people who are symptomatic with the election, since there are so many other activities that these folks are involved in every day, going to the grocery store, or not, hopefully not every day, but often going to the grocery store and hardware store and all these other places. So again, being it's this far from the election, I wouldn't want to speculate any further as to the results beyond what we've already seen.
And Scott, I don't have the latest numbers. As you know, we've been tracking that. I'll be sure our media team gets back to you with what we saw as of today. But again, as the general said, we're getting to the point where the door would be closing on those. And after the first week of May, we will no longer be asking that question about the April election. Of course, we will ask it as future elections occur.
Thank you. Next, we'll go to Artemis Mostagian with CNN. As a reminder, *6 to unmute your line. All right, next we'll go to Shemaine Mills with Wisconsin Public Radio. Shemaine, *6 to unmute.
I would like an update on the isolation centers, not only in Dane and Milwaukee County, but I'm wondering if there's one set up in Brown County with their surge of cases. Thank you.
Yes, there are actually 2 isolation centers in Brown County that the community set up. They had actually set up those isolation facilities, as I understand, earlier in the epidemic in case of the need for people to isolate them and in preparation for any type of surge in cases like they are seeing. So a big shout out to Brown County for their good work in being proactive and setting up those facilities within their community.
Next, we'll go to Addie Bink with WFRV. Addie, *6 to unmute your line.
Hi, thanks for taking my call. I was just wondering if you could tell us at all if the National Guard is in Brown County helping the local health officials with this spike that we were just talking about.
Hi, Addie. Yes, in fact, we are. We've had a liaison team up there for the last few days, working hand in hand with the local public health officials, emergency managers, who are doing a great job of communicating with the health providers in the area, law enforcement, and all of the different pieces and parts that will be involved in getting widespread and in some cases targeted testing out to that area in Brown County.
Thank you. Next, we'll go to Jeremy Janen with Urban Milwaukee. Jeremy, *6 to unmute your line.
For the Deputy Secretary, can you talk a bit about when you're hiring contact tracers, who are those people, where are you finding them, what kind of skill sets do they need?
Sure. Well, traditionally, they're people with training in public health, but very quickly, we're helping lots of people across the state become public health practitioners, including my friend here, the General. And so we really want people who are good with people, who can conduct an interview in a way, who can be meticulous in terms of data collection, because this is both an extensive data collection opportunity and an important opportunity, to provide information to the people that they are talking with. We also need people with a sense of empathy. This is not an easy job right now. Think about a contact tracer who is calling someone 5 days after they have a test, and they may be very ill. And part of what they may be telling them is, you need to go back to your doctor. And sometimes you're calling someone who has been a contact to someone who has had COVID and died. And so we need contact tracers who have empathy for the tragic effects of this virus. We also are surrounding our contact tracers with people who have social service skills, because what happens when we call, for example, someone who is living with their elderly parents and cannot safely isolate in their own home? How do we help them get to an isolation facility? That's why these facilities are so important. Or a single parent living with their children. How can we provide childcare or alternate isolation for the kids? And so if you can't get to the grocery store, how are you going to get food if you're that single parent? So it's both the people doing the contact tracing and setting up a system around them to make sure that people can safely stay at home.
Thank you. We'll next go to Ricardo Torres with the Milwaukee Journal-Sentinel. Ricardo? As a reminder, *6 to unmute your line.
Thank you. Yes, my question is for the Major General. I was wondering if he could expand on operations at the State Fair grounds and St. Francis Seminary.
Sure, Ricardo. Yes, so at the State Fair Park, there's an alternate care facility set up there, and what that is that is extra surge capacity for both local and statewide hospital systems should they reach surge capacity and not be able to have capacity for incoming patients. When we brought the Army Corps of Engineers in, they designed that facility, and it's been a great example of a team effort in Milwaukee. All of those partners that I talked about in terms of Brown County came on board, and they set up that outstanding facility there at State Fair Park. And we've talked many times, we get the question as to how many patients are there or what are the plans to use it. And one of the things, and currently we don't have any patients in it, and that's a testament to how well we've done across Wisconsin in preparing for the eventuality and keeping, as the Deputy Secretary says, keeping the number of beds available greater than the number of beds needed in this battle against COVID-19. In terms of St. Francis, that's the location of one of the isolation facilities. That facility is set up by the city of Milwaukee, and the Guard is involved there in helping with medical staffing and administration at this time. In terms of in-depth questions on that, I definitely direct you to the city of Milwaukee for more information on that facility.
Thank you. Next, we'll go to Dan Malloy with Spectrum News 1. As a reminder, Dan, *6 to unmute.
Hi, first question is for General Knapp about just kind of an update on the National Guard's role in the alternative care facility, if anything's changed in the last week. And then for the Deputy Secretary, how health departments are determining when and whether that facility will be necessary to use at all. Thanks.
So for the first part of that question, in terms of the National Guard involvement at the alternate care facility, there really is no change right now. Once that facility was stood up and outfitted, it was largely turned over to the local officials and healthcare providers to staff and run that facility. We do have approximately 60 National Guard men and women there in a temporary certified nursing assistant role, or they're assigned to the alternate care facility. They're not right there right now, but they're assigned to it and ready to assume those duties when the alternate care facility would start receiving patients.
And just quickly, in terms of health departments themselves will not be referring patients to the alternate care facility. This is a facility for patients who have been in the hospital, so we're working closely with hospital partners on this. It is an opportunity for, if hospitals are reaching their surge capacity, they can move COVID-positive patients to the alternate care facility who are in the recovery stages and who are pre-discharge but not quite ready to go home, who need a light level of care but not an intensive level of care. But it is simply a transfer from hospitals to this facility. They will not be admitting patients directly.
Thank you. Next, we'll go to Pat Pablett with WisPolitics. Pat, *6 to unmute.
For the Major General, of the troops returning from Afghanistan, have any of those tested positive for COVID-19?
So the quick answer to that is no. But thanks for asking that question, because I can kind of explain the process of how we get troops from overseas back to Wisconsin. So first of all, when returning soldiers or airmen are redeployed, they come back on charter aircraft. That's normal operating procedure, not just part of COVID. So those 150 soldiers came by a charter aircraft, and they actually went to Fort Hood, Texas, where they were in quarantine for 2 weeks. and they also did their demobilization process there. So those soldiers who are now back in Wisconsin, thankfully, went through that quarantine process. We did not have any issues with COVID-19 with them. They then flew another charter aircraft from Fort Hood, Texas, to Minneapolis yesterday, where we were able to meet them and welcome them home. Unfortunately, we couldn't have their families there at the reunion, but we put them on buses that took them to all over the state to their nearest armory, where they were able to meet their families and start reintegrating back into life in Wisconsin.
Thank you. Next, we'll go to Mitchell Schmidt with the Wisconsin State Journal. Mitchell, *6 to unmute your line.
Yeah, thank you all very much for the call today. I know you touched a little bit on this, but in regards to the existing isolation facilities in the state, I was wondering if you might be able to speak. I mean, do you guys know roughly how many people have been using those facilities? And then kind of piggybacking off that, is there any update available on the alternate care facility at the Alliant Energy Center?
So we have had people using both the alternate care facility that was stood up in Madison and Milwaukee. I apologize. I actually thought about getting those numbers before today, and I forgot to do so. So again, our colleagues on the media line can assist you with the exact numbers in terms of those facilities. I think one of the things about these facilities, you know, we've never been full in the isolation facilities, and I am cautious about us saying we don't need them too soon, because as we begin to open up Wisconsin and more of us go out to more places, as we said earlier, we will increase the risk for disease transmission. And that is likely when we may need those isolation facilities more than we do right now. So I think it's an important resource that we keep at our fingertips, especially as we start to move from mitigation, safer at home, to containment, as at the point in time we're ready to move into the first phase of Badger Bounce Back. In terms of the alternate care facility in Dane County, the decision has been made to hold on that. We have made the contact with the Army Corps of Engineers, and initial designs are done, but based on where we're at with the pandemic, we don't see an imminent need for that facility. But if things should change, that will we can reinstitute those plans moving forward.
And Mitchell, we can follow up with current numbers on the isolation facilities after the call. Next, we'll go to Cami Rapson with WBAY. As a reminder, *6 to unmute your line. Cami?
Good afternoon. This is for General Knapp. I wanted more specific details on the Brown County situation involving the National Guard. The first part of this, some numbers. How many teams are going to Brown County and how many people are on a team? And the second part, where will you be doing your work? What type of work will you be doing? Kind of walk us through what a National Guard member will be doing in Brown County. Thank you.
Thanks for that question. So in terms of what we'll be doing, we're still developing the plan of action with the local health and emergency personnel. So the number of teams has not been solidified. Right now I have 2 teams earmarked for that operation, but that could go up or down depending on the demand from the local public health and healthcare community. The way that works is what we do is we send up advanced teams to an area like Brown County that has an outbreak, and we work with those individuals to pick out both a location and a method of testing. So there are a lot of different ways that we can set up a test site. There are, in fact, we've already done all of these methods, and basically one of them is to do it in conjunction with an already existing healthcare facility. I know that in the Brown County area there are already existing drive-up test capabilities in the area. I know some of the healthcare providers already have that capability there. We have that capability to augment them or to set up new centers. The second one would be to actually go into a specific workplace or congregate care setting, such as a prison or a long-term care facility. So that's one of the things that we're looking at in Brown County due to the what I'll call an outbreak in some of the industries there in Green Bay. And then the third one would be to set it up an actual community-based testing site that wouldn't be attached to either one of those that I already mentioned, and it would be a true community-based testing site that there would be certain parameters advertised, and then the people meeting those parameters would be able to then show up at that test site and get tested. So in addition to that, I want to take this opportunity to talk a little bit about the guard role there, and more specifically what we are not doing. One of the things that we've heard a lot of concern in some of the communities throughout the state of Wisconsin is that we in some way are involved in enforcement of laws, or that we are worried about other things other than the testing effort. And I want to assure you, and I hope that you can pass on to your viewers and listeners and readers, that the National Guard is supporting DHS and the state effort strictly in specimen collection, testing, and follow-up call arena. And we do not have play any role in any other type of law enforcement action as it would apply to the testing centers. I think that's really important. We've worked really hard in terms of outreach with some of the communities in dealing with the public health officers and them doing the outreach to talk to local spiritual leaders, local community leaders that can help reassure people that we really just need to get a handle on the testing of people so that we can, as the Deputy Secretary said, box in the virus. And that's really all we're concerned with.
Thank you. Next, we'll go to Chuck Kornbach with Milwaukee Public Radio. Chuck?
Good afternoon. Tomorrow in southeastern Wisconsin, there's going to be an example of drive-through testing for COVID. I guess I'm mainly asking Deputy Secretary Van Dijk, is that type of thing you want to see? And also, could you clarify or maybe expand on what you said earlier today about where the testing is underutilized? Mm-hmm. Sort of a two-part on testing.
You bet. So absolutely, we anticipate seeing more of these mobile or drive-through clinics, and we absolutely support those. One of the things that makes those particularly helpful in this situation is that when we conduct a test for COVID-19, whoever is conducting that test needs to be wearing personal protective equipment. Just think about it. You're putting a nasal swab up, which makes aerosolizing of secretions part of that process, and that you have to be pretty close to be able to do that. So by doing this through these testing sites, either through the National Guard or through healthcare organizations who may be setting them up, you can have people who put PPE on for the day and do multiple testing and not burn through as much PPE. So that's why it's an incredibly effective and efficient way of collecting test results. So when I was saying earlier that we have worked on our laboratories and businesses like Exact Sciences helping us increase the number of tests that are available, but yet only having about 2,000 to 3,000 tests done per day. I was referencing there are a number of things we need to solve for to get from 2,000 to 3,000 to closer to 10,000 or 11,000. Part is we're working on our criteria for who needs to be tested. If we, what we have said to this point is everyone who has symptoms of COVID-19 should get tested. And what we're learning about COVID-19 is in the early days, we said that was fever, dry cough, and shortness of breath. What we're learning is COVID-19 can have a whole lot of other symptoms. Things like muscle aches and sore throat and headaches, and as many of us have heard, loss of the sense of smell or taste. So it's broadening those symptoms, so broadening who receives testing. We are looking at whether testing of people who don't have any symptoms makes sense. We haven't made official recommendations there, but that could change things as well. And if we started saying anybody should get a test, we're going to blow past 12,000 tests a day pretty quickly. We need to make sure we have enough PPE. And as you've heard, that's an issue. And so we continue to work on that, and that's where drive-through sites are very helpful. And then finally, it's also helping healthcare practitioners think about this in this public health mindset, that doing the test is really as much about identifying who has the disease so we can do the isolation and quarantine, even though it may not change what the healthcare provider would say to that or how they would treat that patient anyway. Because while COVID-19 is a very serious illness and has a higher fatality rate than we see in usual influenza, it still is a relatively mild illness for many, many people. And so we want to be able to give people good counsel if they're just having mild symptoms, and also give them good counsel for what to look for if they need more intensive health care. So it's a shift from a medical model, an individual model, into a public health model. And we're all working to make that shift together.
Thank you. We'll next go to Denise Lockwood with Racine County Eye.
Hi. So I wanted to ask a question around the accuracy of the COVID-19 test. It's been called into question specifically by Dr. Osterholm with the University of Minnesota. And he wrote an opinion piece today in the New York Times calling the test shoddy because they have issues around sensitivity and positivity. Can you speak to that? And also, what vendors are we using? Where are these tests coming from?
I'm sorry, I cannot speak to Dr. Osterholm's article. I have not read it or studied that. I can speak to where tests are coming from. 48 labs across our state are providing tests. So, everywhere from UW Health to Freighter to Gunderson Clinic to Marshfield Clinic to systems across our state have stood up this kind of testing in their own laboratories. In addition, Exact Sciences here in Madison has stood up testing and is a new producer of these tests. They have gone through FDA approval of their test, and we feel very confident about the results associated with those tests. We've also had a lot of people ask about home tests, and this is an emerging area of work around testing, and we are supportive of the possibility that home tests bring for us. But as Dr. Osterholm sounds like he talked about, we want to be sure that we have adequate specificity and sensitivity before we do that. And the last thing I'd say about this is there is no lab test in the world that is 100% perfect. All lab tests will have some false positives and some false negatives. That's what sensitivity and specificity means. And so, we seek to have the lowest rates of those things, but they will on occasion happen. And that is why we all need to, a lab test is one part of the picture, and we also always need to continue to look at the patient and see how the patient is doing and what the symptoms are, and never hesitate to evaluate further, including repeating a test if necessary.
We'll next go to Tabitha Wethel with WISC TV. As a reminder, *6 to unmute. All right, our last question will come from Jessica Van Egrent with Up North News.
Hi, thanks for taking my question today. Again, my question is about the outbreak in Brown County. There were 1,200 employees at the JBS plant, and from what I understand from the health director in the county today, 255 have tested positive. The plant is no longer open. While it was open, the employees have the ability to get tested there. Do you find it a priority to reach out to employees from that plant at their homes and test them?
As General Knapp has said, there are ongoing conversations about how to strategize the testing in Brown County, and certainly reaching out to those JBS employees is part of that planning process.
Thank you, and that will conclude today's call. As a reminder, this broadcast will be available on the Department of Health Services YouTube channel. In addition, you can find the latest update on COVID-19 information in the state of Wisconsin on the Department of Health Services website, the website of Wisconsin Emergency Management, and the website of Governor Tony Evers. Thank you for joining us today.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.